Welcome back. For many couples, it seems for better or for worse. Does not include tossing and turning during the night. Research shows that more than a third of people choose to sleep apart from their partners. The term might seem a little bit harsh, but it can be a healthy solution to some couples. To talk more about those solutions, we have Dr. Janis Coffin and Dr. Camilo Reyes joining us this morning on our Wellness Wednesday.
Good morning.
Good morning.
Good morning. Good morning.
Good morning.
Thank you both for coming on the show. I think a lot of people at home, this is a good topic, right? So Dr. Coffin, what is sleep divorce and what can cause this?
Yeah, so, I didn't really know about that term myself, but sleep divorce is where spouses sleep in separate bedrooms. And that can be due to maybe the spouses have different work schedules. Maybe someone is snoring real loud in the bedroom and someone's a light sleeper, so they don't get very good sleep. Maybe they're moving throughout the night. They have restless leg syndrome. Or some people have sleep apnea, and maybe they have those machines, and sometimes they make noise, and that can disturb your spouse. And so if we don't get adequate sleep, that can cause us to be tired, frustrated, angry, and maybe cause resentment towards the other spouse. So sleep divorce is you're sleeping in separate beds so that you can get adequate sleep because something else is going on. And I think Dr. Reyes is going to talk about a device that Augusta University is using for maybe some of these things.
So yeah, Dr. Reyes, can you tell us there might be a solution for couples, maybe to get sleep married again?
Yeah, definitely. That's where we get in. So I'm here to talk about the Inspire device, which is hypoglossal nerve stimulator. And what it does is it stimulates the nerve that moves the tongue, and it helps at night when the patient is asleep, opening their airway so they can have a better sleep. The Inspire, or the hypoglossal nerve stimulator, is for patients who have moderate to severe sleep apnea who cannot tolerate CPAP. So it is surgical procedure that is an outpatient procedure. We do an incision in the neck, we put the device in the neck, and the patient goes home, and about a month later the device is activated.
And so who should consider Inspire?
So this is for patients that have moderate to severe sleep apnea. And that's something that we assess with the sleep study, and who cannot tolerate CPAP.
And will this help with the snoring?
It does. The percentage that we have so far is that it can help around like 88% of patients with their snoring.
Oh, wow.
That is pretty significant.
Yeah.
So if you're definitely need something to help you, you should consider this. So you talked about the results. Dr. Coffin, let's kind of continue this talk and just other solutions that maybe couples can do if they don't decide to do something like Inspire. Is there any other help out there?
Yeah, so definitely you want to talk to your primary care physician. If you guys are not if one spouse is not getting enough sleep, is it because someone has benign prostatic hypertrophy and is having to get up 2-3 times in the night? Because there's medication that can treat that. Is it because someone's a really light sleeper and they're having difficulty falling asleep? Again, talk to your primary care physician. There's things that you can do to either help with insomnia, if you're having symptoms of benign prostatic hypertrophy, if you have restless leg. Again, as Dr. Reyes mentioned, if you're having obstructive sleep apnea, talk to your primary care physician. They may refer you to get a sleep study done. And if you do have obstructive sleep apnea, there's CPAP, but for some they can't tolerate that. So there's other things such as the Inspire device that may help with this. So there's different things out there for everybody. Again, if you're having difficulty sleeping, your spouse is saying they're unable to sleep because of whatever's going on, talk to your physician about that and see if there's anything that you can do to help with better sleep at night. Because again, if you're not sleeping well, that can affect your blood pressure, your blood sugars. It can make us have, mental health issues. It can cause us to be depressed. So please talk to your primary care if any of these issues are going on. And again, we have our specialists out here like Dr. Reyes who are there to help with other things as well.
Dr. Reyes, one more question about this device. So once it's in there, it's one and done, or do you keep changing every year? How does it work?
Well, that's a good question, and one that I commonly get. So the device battery lasts for 11 years.
Wow.
It's like a same shape and size of a pacemaker. It goes on the right side of the chest. And basically what we do is, after the procedure, we follow the patient 3 months after the implant, and we just regular checkups because we have to tune the device. We have different settings for a device, and not every patient is the same. Some patient may need a higher voltage, or some like a lower voltage. So that's basically it. And then after that, once we have the patient more stable, we just follow them once a year. and that's it. And actually, the device is Bluetooth connected, so they don't have to come to the clinic. They just go directly to Inspire.
Very interesting. Dad, I hope you're watching this.
Right? This could be a solution. I'm sure a lot of people, their ears are opening up. This could be for you. A lot of people are struggling with this. Dr. Coffin, where can people go for more information and also more information on Inspire?
Yeah, so great question. So obviously, Dr. Reyes and I, we work for Augusta University. So if you go to augustauniversity.org, you can type in either Dr. Reyes' name, you can type in sleep apnea, lots of information out there. Again, if you're interested in a sleep study, type in sleep study, you'll get lots of information. But again, talking with your primary care physician about those symptoms to see what is best and if referrals are needed is probably your best bet to help with better sleep at night.
Okay, thank you both, Dr. Coffin, Dr. Reyes. We appreciate it.
Thank you so
very much.
much.
See you next week.
Thank you.
Thank you.